I've struggled with this my whole life. Just made me so insecure and life-changing. Thank you, Dr. Lebowitz.
Dr. Lebowitz, Long Island Gynecomastia Center. So it's Thursday, kind of mid-October. Very interesting case. So let me talk to you before we show you the patient. He flies in from the Midwest for the surgery. He had surgery done literally 30 years ago? 20 years ago in the Midwest, in Michigan, I'll tell you. And they just did a bad job. Maybe it was the times or maybe it was just the doctor, but they didn't do the correct operation. This is really why you have to come. This is serious business here, to a doctor who knows what they're doing. He's also had some other things, some cancer operations for other type of things. So he's got some scarring from other operations, and which will make this surgery more difficult. We're going to do Vaser high definition lipo, contour, sculpt him to really improve and get rid of the deformities that he has, really from his surgeries rather than from gynecomastia itself. So here we go. This is him. Now stand up straight. So he's had mastectomies in the past. Lift up your arms. He's had a donut hole. This is what I call a donut hole. This is what happens when you go to a doctor who just says, yeah, I'm going to remove the glands. I don't know if they even did lipo. If they did lipo on him, it wasn't efficient. It wasn't the way I do it. You've got to be really aggressive with the lipo on guys. He needs to lose weight. He won't yell at me, and people on the internet don't yell at me either. Oh, look at him and you're telling him to lose weight. But yeah, we want him to look great and feel great. So we're going to do this operation. I'm going to tell you what I'm going to do in a minute. But he needs to work on himself also. Eat better, exercise the best you can, and get into the best shape, body and mind that he can. So all they did was just gouge out the glands, and the nipples are just adherent to the pectoralis major muscle. There might even be some injury to the pectoralis major muscle here because they're just socked in there. And all this fat, people say to me, do I have gynecomastia? Well, here's a perfect example. He doesn't have gynecomastia, but he does have gynecomastia. He doesn't have glands. Glands have been nuked. Glands are gone. They've been just destroyed. It's gone, but he's got fat. Does he have gyno? Yeah, because he's got woman-like breasts. That's what gynecomastia means. But he has no glands, he's got fat. Normally, people have fat and glands. He had surgery, not by me, in Michigan, where they remove the glands, but not the fat, and this is what you get. And you've got to do it right. You've got to contour, sculpt, define, etch, and reveal, his body. Are you okay?
Yep.
Okay. This is serious business here, so this is no fooling around. So what I'm going to be doing is Vaser high definition power lipo sculpture, really bringing all this down to the level of this and releasing this. I'll make an incision, stealth incisions here, 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 and here. Normally I make one in the belly button here, but through his lymph node dissection, because he had cancer in the past, he had a lymph node dissection through here and a gallbladder operation and other things. I'm afraid to go here. He's got some fullness there. I don't know if this is a hernia or just a pocket of fat, but I'm going to go over here. And I'm not going to go symmetrical, because if I do it here and here, it looks weird. It looks like he had surgery, which obviously has it anyway. But I'm going to go here and I'm going to go down here at the level of the semilunaris so I can etch this better. And it looks differently, maybe like drains from his gallbladder operation, which he had, his lymph node dissection, what he had. But, he doesn't really care about scarring per se. So 2 millimeter scarring here and here is not going to bother him. I want to shape him up. I want to make him great. So I'm going to go here and here, do it asymmetrical. I'm not going to do the linea alba because I don't know what's underneath here. I can't do that on him, but I'm going to do the semilunaris, and I'm going to sculpt him around and be careful in the midline. Of course, get all this stuff down to the lats here, do the deltopectoral groove, release this, and do them up. You guys can understand what I'm going to be doing. I want only really good comments. This guy's been through a lot. He's lived with this. So do good comments, because if you do bad comments, I'm going to remove it, because it's you got to, if you're not going to say something nice, don't say it at all. Be supportive to me, be supportive to the patient, But like, subscribe to my YouTube channel. But this is very important. This is serious work, and this is why you got to come to somebody who does it every day, 2 to 3 times a day, right? Right. So I'm going to mark them, I'm going to numb them, and you're going to see what I'm going to do. So now I got to get in here and release this nipple from you. See? There you go. Got to just kind of get in there and release that shoot.
And what?
That shoot.
And what?
That shoot. Oh, we pump you up.
There you go.
To pump you up.
All right, so here we go. He's all pumped up, still has that depression because, you know, even though I inflated literally 4.5 liters of fluid in him. 4.5 or 5.5? 4.5? 4.5. Yeah. It still has that indentation, but with the Vaser technology, it's so important because not only will it melt it, but in a second, I'll get underneath ground zero here. What I'm doing, so my usual ones, if you've seen, I put it over here, but because of the scarring, it would be silly to put it. It would be so hard. So I'm putting it here, and with all his scarring and stuff, if I have it's from the epi. Having one over here and one over here, it's really, they're tiny. It's not going to matter. You don't want to have them symmetrical, as I said, because then you know you had something. But these will look like a drain site from, you know, one of his operations. And this also I can get the inscriptions really well because I want to really etch him to take take the appearance away from this and this crater deformity. I want to really kind of etch him well. Okay, so I released the nipple, just went in there and released it with a little scissor, get my finger in there. So I don't want to really lipo anything underneath here. It's like, you can't, you shouldn't. But now I need to bring everything down. So let's guess how much fat I'm gonna get out. You can see already how it's flatter. Now he's still swollen, how it's really nice and flat. You couldn't put fat grafting underneath this or fat flaps because it wouldn't survive. It really, just so much scarring in there. And and he had so much fat going on here. I'm already out of him about almost 3 liters, a shy of 3 liters. So this is J-plasma, helium gas with a radio frequency spark at the end. This is freaking effing hot. If you put your finger on there, you'll burn a freaking hole. Dr. Lebowitz, Long Island Gynecomastia Center. So, you know, this guy lived with his pre-op, and I'm going to remind everybody of the pre-op stuff. So I did Vaser high definition lipo on him. I melted the fat, stealth incisions, or as much as I want to do the stealth incisions on him in the armpit by the nipple. And instead of doing midline by the belly button, he's got this old scar because he did have cancer. And he needed a lymph node dissection, so he had to open his belly and gallbladder operation. I decided to do one here and one here. Do not make them symmetrical because they'll look like it was something, so I made them asymmetrical down here. And I did the semilunaris on both sides, able to etch the six-pack on him. I put 6 liters of fluid in him, right? 6 liters?
Yes.
6. So he's got a lot of fat in there, but I really melted. Now look at the fat here. Look at the skin. It's thin. Thinned down to paper thin all around here. So there's nothing here. And this is gonna go down. He'll build, I did release the nipple from the pectoralis major muscle. So he's gonna look great. Need be, we can put a little bit of fat grafting underneath there at a separate time, but I don't think he's gonna need that. Build some muscle up on top, lose a little weight, define himself with better muscles, and he's gonna look amazing. Fat-wise, I got out all this fat. This is how much to over 3 liters. No, about 3 liters. 3,200. Over 3 liters. 3,200 of fat. As long as you get at least half of what you put in, you did great. So I put in 6 and got out over 3. Actually, I gave them slightly less than 6, or maybe just exactly 6. But I got out over 3. It's that is our goal. So you have gynecomastia either primary or secondary after a botched job that he had in Michigan 20 plus years ago, 30 years ago, 20 years ago. Call me, Dr. Lebowitz, 631-424-0101, 631-424-0101. Subscribe, like this video, please. Resist the temptation to do comments that are bad, because he reads them, it makes him feel bad. I read them, makes me feel bad, and just constructive comments. We'll try to get his post-op photos to you in a couple of months. He lives in the Midwest, so he's not going to get here, but he'll send me photos over the time. So hopefully, and I will get you those photos in a couple of months, though, 6 months, because I want this to all heal. So Gynecomastia Lebowitz, 631-424-0101, 631-424-0101, or email me, jonathanlebowitzmd@gmail.com, and I promise you I will work my backside off to make you look great. Thank you, and hope to see you soon.